Hi folks, so today we will be looking at the structure of the lower limb, the anatomy of the lower extremities, which is our week 5 topic. And we're going to start out by looking at the joints of the lower limb. We're going to start by looking at the pelvic joint. And this is really where the axial skeleton, so in this case, the sacrum, comes into contact with the hip bones, right? We talked about the structure of the hip bones, and we looked at where these this articulation is between the sacrum and then the auricular surfaces of the ilium that anchors the axial skeleton to the appendicular skeleton. And so the first joint here is the sacroiliac joint. Again, very strong joint, very firm connection or firm articulation between the axial and appendicular skeleton that offers movement, but also flexibility at the hip joint. Important ligaments that help to anchor or secure this joint are the iliofemoral ligament. So the iliofemoral ligament is this red ligament here. It's articulated between the femur and the ilium. Then we've got the pubofemoral ligament, which articulates between the pubis, right, the anterior portion of the pelvic bone, and the femur. And then from a posterior view, we can see the ischiofemoral ligament, which is articulating between the ischium and the femur here on the lateral aspect. So these three ligaments come together and anchor or secure the femur to the ilium and help to keep the lower extremity anchored to the pelvic joint, or to the hip bone rather. I want to point out a unique feature about the iliofemoral ligament. It's this Y-shaped ligament. This is often involved in hip fractures or hip tears, and it's going from the superior aspect of the pelvic bone, right, the ilium, down across to the femur. And there are two articulating heads here, as we can see, giving this a more Y-shaped attachment to the femur across. So that's one way you can kind of distinguish or differentiate the iliofemoral ligament from the other two ligaments, is that the iliofemoral ligament has two heads that articulate onto the femur. Okay, so the sacroiliac joint and the ligaments that anchor the femur to the pelvic bone. Let's actually move into the lower extremity itself. We'll talk about some of the muscles here. And just like we did with the upper extremity, we're going to divide the entire limb into different compartments or segments. So we'll start with the anterior thigh muscles, and then we'll look at the other compartment as we go along. So we've got the iliopsoas muscle here to start. And the iliopsoas muscle is really a combination of two smaller muscles. The iliacus muscle, which sits in the iliac crest here, and then the psoas major muscle, which is closer to the vertebral column, and it's going to be forming the bed of where the kidneys lie. So together, the fibers of both of these muscles combine to form the iliopsoas muscle, and they insert inferiorly on the femur. The tensor fasciae latae is this lateral muscle. It's mostly tendon, so this white bit is mostly tendinous attachment, and that is going from the ilium superiorly all the way down to the tibia inferiorly. This is sometimes called the iliotibial tract, and this is also a muscle of the thigh, although it really is, its function is really as a part of the posterior muscles. It's located in the anterior thigh. Then we get to the bulk of muscles that form the anterior thigh itself. These are called the quadriceps femoris. So there are 4 muscles that are grouped together. 3 of them are superficial, and we can see them easily just by looking at the anterior thigh. The first one is rectus femoris, which is right on top. It goes right down the front of the thigh. The second is vastus lateralis, so this bulky muscle on the lateral aspect of the thigh. And then vastus medialis on the medial aspect of the thigh. And then if we were to peel away vastus if we were to peel away rectus femoris, rather, we would see vastus intermedius, which is a deeper muscle underneath these three. And then we also want to point out sartorius. Sartorius is this strap muscle. We call it a strap muscle because it's really thin and quite long, and it actually runs across the thigh itself, across the anterior aspect of the thigh. It's coming from the ASIS, so the anterior superior iliac spine, and goes all the way to the medial part of the tibia here. And that is a muscle that kind of runs across the thigh and has its function in flexing the hip as well as extending the knee. So the function of the muscles that I just mentioned, right, the quadriceps femoris, iliopsoas, tensor fasciae latae, and sartorius, is flexing the hip. And the action that we want to think about when we think about flexing the hip is bringing the trunk down towards the thighs, or bringing the thighs up towards the trunk, right? So flexion or closing the angle across the hip joint. So here we can see that vastus intermedius much clearer. And this is the cut surface of rectus femoris. So as I mentioned on the previous slide, rectus femoris, if we peel that muscle away, we'll see the fourth quadriceps femoris muscle, which is vastus intermedius. So let's look at some of the other muscles in the region. These are muscles that are more located on the medial aspect of the thigh. There's pectineus, there's adductor longus, and then gracilis. So pectineus, adductor longus, and gracilis. And these are part of the medial compartment of the thigh, meaning that the overall function of these muscles is adduction of the thigh, or bringing the thighs together. And these are some of the muscles that help with that general function. So pectineus, gracilis, which is this strap muscle here, going up and down the medial thigh, and then adductor longus, which is actually a group of three muscles that are called the adductors. This one happens to be the long muscle, which we call adductor longus. So here we can see the other two muscles that are involved in that adductor group. So there's actually adductor brevis, and in order to see this better, we really got to move away those quadriceps femoris muscles and look at the medial compartment of the thigh. So here we've got adductor brevis, adductor longus, and then if we were to strip away those two muscles, we can see this large adductor here, which is called adductor magnus. And as magnus would indicate to us, this is the biggest version of these three muscles, this group of adductor muscles. Let's look at the posterior aspect of the lower extremity and speak about the gluteal muscles, or the muscles of the gluteal region. Now, although these are really a part of the gluteal compartment, we're still going to consider them as we look at the lower extremity because they help with moving the lower extremity. And the general action of these gluteal muscles is going to be hip extension. So that's going to be the opposite of the quadricep muscles and the anterior thigh muscles. This is going to be opening the angle across the hip joint. So think about moving the trunk away from the hip, or moving the hip away from the trunk and opening up that angle across the hip joint. The muscles involved here are gluteus maximus. So here we're seeing a deep dissection view where we can see the cut surface of the external muscles. And so this is the cut surface of gluteus maximus. Gluteus maximus typically runs across the gluteal region. So it's going to cover all of the muscles that we're going to speak about. It's the biggest, thickest muscle in the body, and it's stretching right across here. And again, if we cut away that surface, we'll see gluteus medius. We're also seeing the cut surface of gluteus medius, which extends right over gluteus minimus here. And then the deepest of these gluteal muscles is gluteus minimus, okay? So gluteus maximus, gluteus medius, and then gluteus minimus. And so these three muscles are involved in not only that hip extension, but also actions like rising from a seated position or sitting from a standing position. And they're involved in posture and standing and running and walking, really important in the movement of the pelvic region, which helps to navigate the gait, right? The stepping on one foot, stepping off on the other foot. All of those general functions are involved in the gluteal muscles. Deep to those gluteal muscles, we have a series of other muscles. These are involved in lateral rotation. So think about actions such as opening up the thighs, and they're going to be antagonistic to the adductor compartment. Remember, the adductor muscles are closing the thighs or bringing the legs together. These muscles that I'm going to speak about here are involved in lateral rotation or abduction or opening up the thighs. That's going to include piriformis, so this triangular shaped muscle going from the vertebral column here on the midline, running across to the femur. This is piriformis. Inferior to piriformis is superior gemellus. That is separated from inferior gemellus by the obturator internus. And then inferior to that is inferior gemellus. And then the largest muscle of this group is this square-shaped muscle called quadratus femoris. And anytime you see the word quadratus, that is usually meaning a muscle that has 4 equal sides, or is kind of shaped like a square or a rectangle. And that is the shape that we see with this quadratus femoris muscle. So I'll say those here again. The piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. All right, so that is the anterior and posterior thigh region. We're going to move down and speak about the joints of the lower limb, the knee joint specifically. And then we'll look at some of the muscles along the back of the thigh. So the joint at the knee is a little bit of a complex one. It's quite complicated. There are several ligaments that are anchoring the knee joint and helping to keep the tibia tightly adhered to the femur here. Now, one thing I want to point out before I go into the names of these ligaments is that we want to appreciate here that the femur is not a part of the knee joint. I'm sorry, the fibula. Excuse me, the fibula is not a part of the knee joint. It's actually sitting beneath the head of the tibia. And so there's only one ligament that actually attaches to the fibula. The other ligaments are going from the tibia to the femur. So we've got a series of cruciate ligaments. We've got 2 cruciate ligaments. Those are called anterior cruciate ligament, shown here in blue, and posterior cruciate ligament, shown here in yellow. And these ligaments are found in the medial aspect of this joint. They're actually crossing each other, hence the term cruciate or cross-like that is associated with the name of these ligaments. So they're really going to be stabilizing the movement of the central part of this joint. On the lateral aspects of the joint, we've got the lateral collateral ligament going from the head of the fibula to the femur. And then on the medial aspect, we've got the medial collateral ligament going from the head of the tibia up to the femur as well. And these are, as you would imagine, stabilizing the lateral aspects of this joint and preventing overexertion or overextensive injuries that may be caused by lateral rotation, so excessive lateral rotation of the femur and the tibia. And then the final components of the knee joint are the menisci. So the menisci are these cartilage-lined surfaces of the tibia. We've got the lateral meniscus that comes in contact with the lateral condyle of the femur, and then we've got the medial meniscus of the tibia, which comes in contact with the medial condyle of the femur. And so these 6 structures, both cruciate ligaments, both collateral ligaments, and then the medial and lateral menisci together work to articulate and secure the tibia and to a lesser extent the fibula, anchoring that to the femur, right? Securing the knee joint and also offering stability to the knee joint.